Ugandan child who grows up in an impoverished household will most likely grow deeper into poverty, even in their later years.
The majority of the population are young. You have them poor, you have a poor quality labor, you have poor education outcomes, you have poor health outcomes, you have lower incomes. There is no question about it.
At the launch of the Situation Analysis of Child Poverty and Deprivation report in Uganda, the first in the country to document child poverty, the Unicef country representative feared for the future of the Ugandan child. Nutrition, water, health, sanitation, shelter, education and information. 7 critical aspects that are important for any human being, especially a child. Now, in a new report released by the Ministry of Gender, Labour and Social Development in partnership with Unicef, a child is considered to be poor if they do not have 2 or more of these. Now, most of the children in the country, especially those under 5, do not have these. To the Executive Director of the National Planning Authority in the government, nutrition stands out, where every 1 in 3 children under 5 years are stunted. This translates into 2.2 million children.
The formative stage of a kid has a big impact on its cognitive capacity in future.
In terms of national development, one study shows that undernutrition is estimated to cost the country an alarming 1.8 trillion Uganda shillings annually in terms of lost productivity.
The State Minister for Disability and the Elderly, Sulaiman Madada, says that though there have been gains in terms of poverty investment in the country, the children have been left out for long.
57% of the Uganda population, the population of age below 18. 20 serious country leaders, planners will take this as a serious matter.
When it comes to information, 57% of the poorest children suffer from extreme deprivation. That is about 6 out of every 10 children. These have no access to radio, TV or mobile phones. Sanitation continues to be a thorn, especially for the rural child. 1 in every 10 does not have access to a toilet or latrine. Open defecation has become the norm, and it comes with many health concerns. Regarding health, 3 of every 10 children under 5 are deprived. Shelter is another, with the Karamoja and Northern child bearing the most brunt. The main drivers of disparity are the household characteristics, geographic and regional location. With education, if the household head is not educated, then the children are 5 times more likely to be in extreme poverty. The report indicates that children in the north, inclusive of West Nile, are about 3 times more likely to be extremely poor than in the central region. The same can be said of rural versus urban areas. To control child poverty, Dr. Muvawala says that the government will have to come out strongly on this worrying trend.
Dealing with the community. They are the ones who have more resources than government. Adjusting planning systems in government to address these issues. Focus and target the worst groups.
The problem is that the planning systems have not been human rights based for a while. They have been generalizing the populace.
We don't put on the same size of shoes. So we need to do more work. It's more expensive, it's more tedious, but we need to do it.
Interestingly, however, is the fact that a home headed by a female is likely to see to lower poverty among children.
Their mothers, they are more likely to spend the little money they have on the welfare of the children compared to men.
The children interviewed were a great contributor to the report in bringing out the non-income aspects of poverty. In a problem tree, children aged 11 to 14 cited reasons such as drunk parents, death of parents, rape, disease, neglect, poor climate, amongst others contributing to their state of being poor. Florence Naluyimba, NTV.